We're now going to look at specific examples of home care, of excellence in home care. First example is of a woman named Frances who is recovering at home after surgery. Frances lives on a farm about an hour away from the hospital. She woke up with terrible pain, and so she goes for emergency surgery, which is successful, and returns home. Her husband Willie is out on the fields during the harvest, but prepares her meals for her, most of them. Her daughter Marion, when not at work, ensures that her medications are correctly taken. She cleans the bed linens as needed and is there usually when the nurse arrives, so that she keeps up with the medical progress of her mother's condition. The nurse comes every day for a week and then comes about every 3 days after that. She provides bed baths until Frances can do it herself. Marion cooks and freezes meals for Dad to warm up. Neighbors and other family friends help with this as well. Neighbors also help Willie with the harvest. They fill in for Frances because she used to help her husband with the harvest. Family and friends take turns visiting during the first week, so Frances is not alone much of the time. A neighbor's daughter walks the dog, waters houseplants, and tidies up a bit every day. Another example is Nimi. Nimi lives in a long-term care at home situation. He is 82 years old and has multiple health conditions that require home care. His wife of 45 years died a few years ago. He has no family nearby. His care coordinator ensures he has home nursing every second day, that he has a raised toilet seat to help with that part of his care, comfortable air mattress for his bed to avoid bed sores, and that the bathtub is made safer. A home support service person comes 3 times a week to cook, to do laundry, and to do some light cleaning. A community volunteer coordinates the visits of old friends and neighbors so that someone sees him nearly every day. A good friend of his and his wife makes it her business to ensure that he is getting what he needs when he needs it. When she can't do that, she makes sure that someone else does. He knows that when he gets sicker, he will likely have to move into a care home. He's working with the care coordinator to prepare for this. Although he is alone physically in his home, his neighbors, his community, his church members, and his bowling buddies all ensure that he has as good a life as possible. In both of these situations, you can see that there are not a great number of professional people involved. This isn't about bringing in 20 different doctors, nurses, social workers, allied professionals, chaplains, and volunteers. It's about using the resources within one's family or community to make the best of a situation that happens to all of us. There's a cautionary tale with this, however. The people providing most of the care must understand that they have a deadly phrase in their unconscious or conscious mind. And this phrase begins with the words, "I would rather be dead than have," and then there's a blank. And most of us fill in that phrase with words like, "I would rather be dead than have dementia, or cancer, or Parkinson's disease, or diabetes, or heart disease." Or we may fill in the words with poor, or homeless, disabled, lonely or isolated, or whatever the case may be for you. We must be cautious that if the person we are supporting has that kind of condition, we not do anything to take away their hope, their supports, or their will to live. We need to be there as life-affirming and as supportive as we possibly can be. So in these examples of Frances, who lives on her farm, and Nimi, who lives in his own home in a long-term care situation, but without anyone in the home with him, the examples highlight how it is individual people, the relationships that both Frances and Nimi have built over time, that come to help in a time of need. And the time may be a relatively short time, as in Frances's case, as she's recovering from emergency surgery, or it may be a longer-term commitment. And we will look in the second last unit on how to create that circle of care around the person you love and around yourself as well. And we looked at the cautionary tale of, if we have this phrase in our minds of, "I would rather be dead than have a certain condition," and the person we are caring for has that condition, we must bring in as many other people as we can to provide a lot of that support so that hope and practical help can be provided at all times. Our next unit, we'll be looking at basic care, how to provide basic care and what that care looks like.